Hey Jess, can you hear me?
Oh, I think you're just connecting.
There we go. Can you hear me now?
Yeah. Hi.
How are you?
How are you?
I'm very good. I wasn't that far from you a couple of weeks ago. I was in Auckland doing some teaching.
How are you?
Yeah, it's by the harbour. I'm not sure what the
Oh,
actual place is called.
lovely. Where
That's
are you
good.
now?
I've just landed back in London about an hour and a half ago.
Oh, wow.
But I've just come from Jordan. I was not from New Zealand.
Oh, okay. Right. I was going to say, jet lagged. Are you awake?
I am a little bit, but I'm used to it. It's pretty normal now. Very often I'll jump off the plane, jump on stage, jump back on a plane. It's
Oh my
pretty
God.
common now.
Crazy. Let me just set this up so that you get the plug
Cool.
in at the same time. It's been very busy this morning.
No worries, no worries. What time is it for you?
It is 9 o'clock.
Okay, so it's exactly 12 hours. That's not too bad
Yes,
then.
yes, actually. I have quite a large London client base, so I know that
Oh,
lots
cool.
changed recently, and
Yes,
it's so much easier for them to see me. So, oh,
definitely.
right. Welcome. Nice to meet you.
You too. You too. I think
Basically,
you said that you're interested in skin, wasn't it? Like tightening of the skin.
yes. So basically, it
Cool.
was a podcast with Bart, and in I'll give you a little bit of back history if you don't know. I don't know if
Yeah,
you know
sure.
much about me. So I'm in health. I did my degree in sports back in the day, and actually Bart was one of my professors at uni, just funnily enough.
I know. Yeah.
In about 20-ish, 21, my boyfriend found carnivore and he was like, this is amazing. I've been in the health industry for a really long time and I was paleo basically for ages. And
Okay.
I was convinced that we needed vegetables and that we needed, to eat all the colors of the rainbow and just all the generic indoctrination that there is with nutrition. Um, and so when he found it, I was like, no, I don't want to look at it. Like, vegetables are good for me. Vegetables are good for me. And what happened was he was actually working out of London because we used to live in London. He was working in
Okay.
Norfolk. And every week he got back, it was like really obvious. His skin was transforming. His
Wow.
insomnia went away. He healed a whole heap of things that we didn't really think was healable, especially because we thought super healthy with what we were eating with protein and vegetables.
Of course.
So I basically had to look at it because he forced me to open my eyes and actually see the results of what vegetables do to our body, and that opened up the world to me. So he originally was like, look at this research, look at speak, like listen to the sky. It's really interesting. It makes a lot of sense. And I was like, no, I don't have time to look at that. I don't have time to research. I'm so busy with my work and my own things. And when I finally clicked on the link, it was a YouTube video of Professor Bart. Okay.
Ah, okay.
I went to university with him. He was my mentor at uni, blah, blah, blah. And so that was the rest of history. So 2022, I went like strict carnivore, like haven't eaten anything other than
Okay.
animals. But for a year before that, I did a transition to heavy meat based.
Okay.
Um,
That's a long transition.
so yeah, I did it slow. I was pregnant at the time and it was
Ah,
just
okay.
all that kind of
Yeah.
jazz. We moved countries and it was lockdowns and it was just a crazy world. So yeah, I did what I could for a while, and I was just eating low oxalate vegetables and that kind of thing for a great period of time. And then in 22, Bart was like, just do the 90-day challenge with me. Let's just do it. We'll document it, da da da. And I kind of had this plan that I'd go back to eating, those low oxalate vegetables after the 90 days, and that I was just going to do it temporarily because I like vegetables and I want them in my world still. And I did the 3 months and it was just like night and day in terms of my body and
Yeah.
my health and my energy and my skin. I've got 3 little girls, so I have got quite a lot of loose skin on my stomach. I'm 41. I'm very expressive with my face. I've got a lot of like expressive lines on my face. I've never had any kind of botox or any kind of any work. done on me at all.
Good choice.
Yeah, so far so good. And I have been healing pretty much since that began. And so that's been kind of my journey with carnivore and how I got here, and then just the
Amazing.
synchronicities of life of meeting Bart again and having him in my life again after so long. And yeah, just super grateful to have found this way of helping
Yeah,
others.
same.
Yeah,
So
yeah,
I kind of stumbled into it as well. It was just research.
yeah,
I learned about the Randall cycle for the first time when I was in uni,
yeah.
just as like a side note from one of my university tutors who didn't fully understand it himself, but he
Mm,
mentioned it. I never paid attention, but I remembered it. And then when I got more into nutrition and obesity and metabolism and mitochondria in my career, I ended up exploring it again and again and again. I thought I've got to be an idiot because I don't get this thing, because I assumed the diet guidelines were correct.
yeah.
And then one day I thought, what if they're wrong and this is correct? And that's when I decided to try carnivore, which but I didn't really know carnivore was a thing.
Mm,
I just did it based on the metabolic pathways, and then I discovered it after I started.
amazing.
Yeah.
So what health
But
changes have you mainly had for your own
I
personal
mean,
of it?
I never had any health issues, luckily.
Mm,
I did have an asthma inhaler, and in the winter, occasionally it would just pull up a little bit in terms of my breathing. But then I don't need it anymore. Like that's gone. Um, that's the only kind of health thing, but it was pretty minor, I'm not gonna lie.
yeah,
The only other thing is pretty severe hay fever. Like every summer, I'd have to go home from work at some point because I literally couldn't see the patient properly when I had like instruments in my hand. And so obviously it was a risk, so I had to go. This year, for the first time ever, I haven't taken a single antihistamine ever.
wow,
And that's never happened since I was a small child when I first came to the UK when I was 5 years old. So apart from that, I feel like I've got unlimited energy. Like
yeah,
when I was in New Zealand, that entire 2 week period, I was in like 5 or 6 countries, and I still only had 1 meal a day. Everyone else who wasn't traveling when I was visiting them, they got tired, but I didn't, and they couldn't understand why. And I said, "Well, I'm not having carbs, so I'm not having a
yeah,
crash."
yeah.
And then mental clarity, the focus, the calmness. Like I don't get pissed off as much. Still get pissed off at vegans, but it takes a lot more to get me pissed off.
Oh, hilarious.
Yeah. So it's been a journey, but I won't go back.
Yeah,
I wouldn't go back at all.
it's the same as me.
Yeah.
Once I did the
Yeah.
3 months, I was like, well, why on earth would I ever go back to eating that? The
Yeah.
cost of it, the cost of it's something too. It's like the cost of vegetables and fruits
Yeah.
and
Yeah. Definitely.
I have always known that sugar is poisonous at a cellular level and not to eat it. And so I haven't eaten fruit for probably a very, very long time, like close on 20 years. And I haven't
Wow.
eaten processed foods since I was in my teens either. So for me as well, my health was at a pretty good state. I got into health. I did my degree in sports. So I became a PT. I did lots of postgrad certificates and pieces and different bits. And so I was pretty healthy. Um, and in about 12 or 13 years ago, I was introduced to
Oh,
this rare form of neuromuscular based therapy. And
okay.
it was life changing for me. I was in London at the time. I was doing some certificates. Have you heard of muscle activation technique?
No.
So MAT has been around for a while, but basically I was doing some postgrad certificates and that kind of thing, which was all about trying to restore muscle recruitment through this technique. So I was doing some specialty training and I was introduced to Simon Frost, and basically it was kind of like right place, right time again. And he had created this incredible tool where we can restore muscle function, muscle control, muscle recruitment instantly in the nervous system and brain. And
Wow.
so, in terms of like motor function, motor control, strength, mobility, range of motion, control over range
Wow.
of motion, pre and post operative, stroke, cancer, neurological disorders, like it's massive.
Wow.
Yeah, I was learning that in London and doing all my specialty training. And so I already had like a really good health, a very calm nervous system, like the things you were talking about before that you gained from having carnivore, the carnivore
Yeah.
calm that people talk about. you know, I already had experienced that through learning this tool, which also regulates your nervous system and strengthens your nervous system. So I was
Right.
pretty calm and pretty cool when I came across carnivore, but it definitely took it to next levels as well. Um, and yeah, it's just been like another thing that I've added to the way that I help
Yeah.
beings.
Well,
But one that I've found is like such a blanket approach for everybody. People always ask me,
yeah.
like, is this something that is for me? It's for every human. If you're a
If
human,
yeah, I agree.
so like even me doing this when I was pregnant, I had a lot of people getting concerned that I was taking out carbohydrates and what would that mean.
Yeah.
There's a lot of fear around what we are meant to put in our mouths, and
I know.
yeah. Um, so yeah, I feel super, super blessed. So already with carnivore over that 90 days, oh, I don't know if you've seen my before and after pics, but
I think
I
I saw it on Bart's channel. Yeah.
yeah, it was like body composition, yeah, great, but it was the skin that was awesome as well, because I have quite a lot of
Yeah.
post-pregnancy skin from my births. And I've done work myself on the different parts neuromuscularly that I can treat on my skin, because we can work with skin and fascia and myofascia, different levels of tissues. And so I've
Yeah.
done some work, and that's really improved it. And then carnivore's really improved it. And then now I'm looking for like the next pieces, because for me, I want
Sure.
to be the best optimal version of myself, and I want to
Yeah.
be able to offer different modalities to people that are looking to heal or help themselves. And
Yeah.
that's when I was like talking about, and I was like, right, what's the next stage? How do I tighten the skin further? How do I improve my skin further? How do I, even on my face and stuff, with the
Mm.
neuromuscular stuff, we can treat all the muscles and tissues in the face. And obviously, how you live your life is going to very much show on your face, because if you're miserable and you're frowning all the time, then those are going to be the lines that choose to indent. um,
Absolutely.
yeah, so I'm like, right, what's the next stage? Is it intensive training? Is it fasting? Is it like, where do I go next with the skin thing? And he was
Yeah.
right, you need to speak to Dr. Abs and get together and have a chat. And so that's how I came across you. um
Nice. Nice.
so yeah,
Yes,
I'm
I do cosmetic and longevity medicine now. Like that's the easiest way of putting it. They're not, I mean, longevity and cosmetic, they're not recognized specialties, but I
mhm,
say that just so without explaining everything in detail in one sentence, people understand what I'm actually on about.
yep,
Um, and for me, it is the exact same thing. Like mitochondrially, when you're healing a wound, when you're closing a wound, versus when you're producing nice elastic fibers for good looking skin, versus when you're just having optimal output as part of natural normative organ function. If you could only see the mitochondria in all those situations, it's actually doing the same thing the entire time. So for me, it's all of those things are the same thing, but there's different perspective you can have on all of them. And when we do the talk, I can go into pictures like before and afters of how we treat the skin locally by essentially mimicking a carnivore diet almost
mhm,
outside the cell. So in the actual extracellular matrix,
mhm,
we can put things in there, not like mesotherapy where you put vitamins and minerals, but actually just components naturally of the ECM, the extracellular matrix, that you only really find when you're very young. And so the cell behaves like it's very young. So it's kind of doing what the carnivore diet is trying to do systemically, but on a forced local scale. And it's pretty incredible what we can achieve.
and how do you do that?
So it's a good question. So it depends on what the situation is. Let's say we're just looking at aesthetics, like aesthetic medicine,
Mhm,
and someone like a patient comes see me in my clinic and they say, look, I don't like the looseness or all these sorts of things. Then we can inject certain things in there.
right,
But I don't like Botox for anti-aging. In fact, I recommend not doing Botox for anti-aging because it's not anti-aging, it's just freezing. There's a
yeah,
difference between anti-aging and stopping movement. They're completely different things.
yeah.
But it's a great marketing tool.
I
And I
love that you said
also,
that, 'cause that's so clear, and it's something that they do really promote, don't
yeah,
they? Um,
absolutely. And it's complete BS, complete
yeah,
and utter BS.
yeah,
And I only recommend dermal filler if the true diagnosis is volume loss, then you can replace that much volume that you've lost. In which case it's entirely appropriate. Obviously, pick the right one, blah, blah, blah. The moment you go beyond that and you just start to look weird, like I'm not interested. That's not for me.
Yeah.
Um, and then you've got stuff like this, which is not trying to freeze you or make things bigger. This is trying to regain lost cell function, which at the end of the day is what you're doing with carnivore. When people's eyesight gets better, when their injuries heal, you're regaining lost function because your metabolism is now back to normal. But we
Yeah.
can do that not just systemically in our organs from manipulating the diet, but like I said, we can force that on a local scale in particular tissues. So we do it with this. We can do it with even nutraceuticals that work in the same way all over the body. We can do it in wounds. So I can show you some pretty gruesome wounds of even like 2-year-olds, babies in ICU, systemic second degree burns. You look like they're going to die. Suddenly in weeks, you look like they've had no wound. And it
Wow.
works even in those sort of situations. I've got data that shows we can make cancer cells self-destruct while the host eukaryotic domestic cells get stronger with the same nutraceutical. And again, we're just all we're doing is optimizing cell function. That's all it is. But it's what I was in New Zealand for was actually to do this. This is exactly what I was teaching the doctors in Auckland. So if you've got a lot of
Oh,
big audience in New Zealand, they can get this now. Like they can just walk into a clinic and request this.
oh wow.
Yeah.
Um, and in terms of like post pregnancy skin and tightening with
Yeah.
really severe
Yeah.
envelopes of tissue, can you do stuff
Yeah.
like that too?
Let me show you a picture.
Oh, I'm
Oh,
so
can you make me a host so I can share screen?
um how do I do that?
I think if you go on participants,
Oh yeah.
there should be a, oh, if you hover over the camera icon, there should be a more with a drop down arrow.
Oh yeah, there we go.
And then maybe it's in there.
Oh, it says change host. Can I just add you or something?
Yeah, so maybe if you make me host temporarily, I can show you the
Yeah.
pictures. There we go. So let me share the screen. Uh, there we go. Can you see this?
Oh yeah.
Yeah, so
Wow.
that's post-pregnancy. Now we've
Yeah.
not done any lasers, so there's no risk of scarring or burning. There's no skincare that's been done. There's no filler, no Botox, obviously. There's no microneedling. It is literally just injecting these particular ingredients, which aren't even drugs. Like it's partly just hyaluronic acid, but
Right.
specific weights, because
Yeah.
hyaluronic acid as a phrase actually means nothing. You have to specify the molecular weight, and then you
Right.
have a different signal sent to the cell, because it's just as much of a signaling mechanism as a growth factor, actually, but people don't realize. And then we have particular ratio of particular amino acids because mitochondria have nutrient sensing pathways. And so that's why diet plays such a huge role in aging, because when we have certain nutrients brought in and we have enough protein, the mitochondria can sense that and they can work properly. And that's why this is not that different, if people wish to think of it this way, is trying to implement a carnivore diet on a localized cellular scale. So the
Yeah.
cell behaves locally like a systemic carnivore diet almost. And so you regain all these functions from the mitochondria, from the cell. And in every organ, the regaining of function is specific to that organ. So if you do it in skin, it just becomes better skin. If you do it in a wound, the wound just closes. If you do it in mucositis, the patient recovers from cancer chemotherapies much, much quicker. And so in this case, all that's been done, tiny little blobs have been injected either side of the belly button, and that's it. And then it's just
Wow.
tightened and shrunk back in by itself.
It's amazing.
I don't know if
Oh,
I've got any more here.
exciting.
There's another one that's different parts of the body, but no difference in product, no difference in technique, just works the same way. And typically,
Wow.
what you might do in stuff like this is a radio frequency treatment where you apply loads and loads of heat, and the heat will cause coagulation, and
Mhm.
the body takes away coagulated dead tissue to replace it with brand new stuff. That's the theory behind it. It's logical, but the problem is you're not actually improving the quality of the cell, destroying it, which is why you have to have many, many sessions. You might like 5 to 10 sessions to really have a result by destruction. Whereas here, there's
Right.
no destruction. You're just
Yeah.
regaining function and everything sucks back into the body. This is a side effect. So you do that. It's not just about tightening, but all cell functions. So even pigmentation automatically as a side effect improves. So it's not designed for laxity. It's not designed for pigmentation. It's not designed for texture. They're all just side effects. What
Yeah.
it's designed for is nutrient sensing pathways.
Hmm.
That's it. And if I also zoom in, you can actually see little bits of white. So it's actually healed the active acne as well. Again, different patient, but same. This is a clinic that did it in NY Skin Clinic in Scotland. You can see all the crepiness here, and it's completely disappeared.
And is that just
Lighting is slightly different.
how many treatments is that?
That will be about 3 sessions, 2 weeks apart.
Right.
And it's very, very comfortable. I mean, I don't even use numbing cream for my patients, no anesthetic whatsoever. And that would probably take me for both arms, 10 minutes. That's it.
So if you're repairing, so to speak, if you're gaining back, how long would that result last for? What's the
So
natural
the result,
duration?
so the cell function, in terms of the lifespan, so there's two answers to this. In terms of the study that's looked at the actual lifespan, it's not possible to do a study long enough because it goes on for so long.
Right.
And I've got data to show why if your viewers are interested as well. And the second answer is once you revert the cell back to its function, it's down to you as to how quickly it loses it again. It's like saying once you go carnivore and you get your vision back, like Bart's vision improved, how quickly does that go back? Well, it depends how much KFC you then decide to eat every day.
Yeah, yeah,
So it's
sure.
exactly the same answer.
Yeah.
Now, to try and put a figure on it, I've had patients, come back a year later, year and a half, and things still look the same because they're looking after themselves. So
Yeah.
it's not like where you have to have filler top-ups all the time.
Mhm.
Once you set the age of the cell, well, quote unquote, once you do the work to the cell,
Yeah.
that's it. It just carries on aging at whatever speed the rest of your body is aging. But if you've done the carnivore diet, now that you've regained all the function, as you go forward again, it's going to go forward much slower.
Yeah.
So you're much better off if you're on that kind of diet.
Mhm.
And again, obviously, we have that one. So this is stretch marks as well. So you can see, for example, that one is just completely destroyed. And that's an atrophic scar. So it's dipping in. But we can use this on hypertrophic scarring as well, not just stretch marks. And the reason it works on that as well, again, it's cell function. It's just a side effect. You put this in and everything starts to improve. It's designed mainly for the connection between the two skin layers, the epidermis and the dermis. And the
Mhm.
stretch mark, if we want to go into detail one day on a video or something, a stretch mark is basically just a lack of integrity of that connection between the epidermis and the dermis, the dermo-epidermal junction. And during times of rapid size increase, so puberty, pregnancy, obesity, for example,
Yeah.
the integrity is lost because of the speed at which you're asking it to grow. So it takes certain shortcuts. And the trade-off is that, yes, it can expand, but you get left behind with these sliding marks. And yet, when we put this stuff in, we recreate what should have been there in the first place because the body recognizes what's not right. And then,
Cool.
yeah, I mean, if I had time, I could have put a little bit, a few more. I don't know if there's any others I can show you.
Awesome. And I think that there will be a lot of people that this will be really interesting to because they are
Yeah,
already looking to feel better. They're already working
yeah,
on health, nervous system, and food, like all the different
yeah,
components of it. Yeah, I'm excited to be able to share this. And I want to definitely, because I am one of those girls that tries everything on herself before she does anything.
yeah.
But I'm excited to see what results we get from that.
I mean,
Now,
I can put you in touch with people. That's not a
yeah,
problem. So you can go and
definitely hook
have a
me up
go.
with some reliable sources. Wow, that's amazing. Because I do
Uh,
want to age gracefully and
yeah,
NRT, which is what I specialize in, that is also essentially we're working with
yeah,
your bioenergetics and your nervous system function, and so it is anti-aging. So I'm going to
yeah,
do everything that I can do myself on my end, but I don't want to
yeah,
go under any knives. I have been waiting for technology to catch up with the fact that it's 2024 and we have no hovercrafts or being able to teleport ourselves. Like, what is going on?
yeah,
I don't want to go under the knife for that. I
yeah,
would not want to get a tummy tuck and have like a massive scar from one side of my body to the other. Like, I want to
yeah,
support just eating naturally, being in the
yeah,
sun, grounding, just all the most natural
yeah,
parts of it as it can be, and then
yeah,
aid it along. I don't want to end up, you know, looking like,
yeah. I mean, that's why I always recommend this to patients because There's never been a single adverse reaction with this treatment ever in over 1 million procedures
Wow.
because the ingredients themselves aren't drugs. There's nothing foreign to your body.
Hmm.
First of all, amino acids, no one's ever going to argue that amino acids are dangerous. And then the hyaluronic acid, technically hyaluronic acid can be dangerous if you get really deep into the science. I mean, I can metastasize someone's cancer if I wanted using just hyaluronic acid.
Yeah.
So you do have to be specific, and obviously the specific about this.
Mm.
But because they're the only ingredients, you can't have an adverse reaction. In fact, I have 6 patients here in London that have this in their face every 2 weeks for life. Nothing ever goes wrong. There's never any risk. There's never any harm. There's no such thing as too much. It's like saying, can you eat too healthily? I mean,
Right.
it's a ridiculous question.
Mhm.
And so there's no such thing as making the matrix around the cell too healthy.
Yeah.
It doesn't exist. That concept is completely invalid.
Mm.
And so there can be very little risk in this. And that's why I tell them it's a very natural treatment because
Yeah.
you're not actually implanting anything. Nothing is actually left in the skin. You're just making the cell think it's in someone younger. So if you
Mm.
think of a fibroblast in the dermis, making whatever elastic fibers it's making, the only reason it knows it's in an 80-year-old versus an 8-year-old is because the receptors in the membrane are touching what's outside and it can gather information like a blind person reading a menu in Braille.
Hmm.
So if we just manipulate that matrix, we make the fibroblast think it's someone younger. That's how the product works,
That's
essentially. And in fact, I'll send you this in the chat.
amazing.
So that's a talk that I did in Auckland actually a few months ago, basically giving like an introduction as to why this product is different. The talk focuses on the face, but
Yeah.
the technology is 100% identical for the body. It's just
Right.
because that conference was mainly concerned about the face. But if
Yeah.
you watch that, you get a rough idea of why it's so unique on the market,
Mm.
and why there's no adverse reactions, there's no risks at all with it.
Yeah. That's so cool. And tell
Yeah.
me how often you have it.
So I've never had it.
Oh,
Actually, I should have it.
oh my
The
God.
problem is, the problem is I need to find someone that I trust to put a needle in me. That's the
It's,
thing. This is a problem for a lot of doctors. They never have the stuff that requires a needle. Stuff where they can hold it in their hand, like a laser, is
Mhm.
very easy.
Yeah.
But stuff where there's a needle, like it's very difficult to do to ourselves on our own face. If it's on the body, I probably wouldn't mind. But on
Right.
the face, I'm gonna have to stick to the carnivore diet.
Hmm.
And actually, in terms of skincare now, the way I work, every single patient, we usually, if they listen, we only have one product in the
Yeah.
entire. There's no routine, one thing, and we're done.
Right.
And typically, it's either strong retinoid or what I'm now using a lot is testosterone propionate,
Oh yeah.
which
It's
sounds like,
cream.
yeah, yeah, but it sounds like TRT, but
Yeah.
it's not TRT because it does nothing for the body.
Yeah.
It only works in the local area.
Yeah.
And I've seen just the stupidest results of my life. There are people close to 90 who have lost every single wrinkle. And I don't mean it's gotten better. I
Yeah.
mean, it's gone. Like there is
Where do you get
zero
that
depth.
from? Where can you get that from in New Zealand?
So that is prescription only,
Mm.
unfortunately.
How would you?
So you have to work with someone who can prescribe, who also has a relationship with a compounding pharmacy.
Oh,
So that's the way I work here. I mean, I've got some patients in New Zealand who fly back and forth, so they pick it up.
oh yeah.
Or I send it to friends that they have in the UK and they collect it from them. That's not an issue.
Yeah. Yeah.
There may be a way to export it to New Zealand, but you have to wait till you've got a CDE license, controlled drug export. And I know NZ customs are pretty strict,
Yeah.
so
Super, super
it's
tight.
hit or miss.
But my in-laws
Um,
are in London and coming over in the early January, so I might
ah,
sort that out then.
yeah,
Get a
yeah,
look.
no worries. If you do want it, let me know.
Yeah, I will.
I'll just figure out what the cost is, and I'll just send you a link for that, and it'll go straight to the pharmacy. So I make nothing on it.
Yeah, amazing. Thank you.
Yeah.
That would be so
It
great.
won't be much. It's probably going to be ballpark figure 70 to 80 pounds,
Yeah.
plus maybe £5 postage, and that'll be enough for probably 3 to 4 months
Okay. All right, cool.
ish. Yeah.
Well, my hubby is will want that too, so we'll get a couple.
Okay. You can get
Yeah,
two. Yeah. Yeah.
get a few. But that would be amazing. Um, and would you suggest doing that before going through this injectable process?
Good question. It doesn't actually matter
Mm.
because the test cream is going to be working on ARs, which are androgen receptors, and that's going to have a nice effect in the cell. But at the same time, if you do the injectable first, you're still going to get a great result. It doesn't actually make that much difference. Whenever you can start both, just go for it. And I personally feel there's going to be a potentiated effect with each other, because part of having a younger body or environment is the difference in hormones as well.
Yeah.
So if we can improve the ECM in terms of both the hormones as well as the actual general components, glycoproteins, proteoglycans, all these sorts of things, even better.
Cool.
Yeah.
And then do you use any other like things to assist with regeneration repair, like infrared or anything
Yeah.
like that? And you use that daily or?
Good question. My issue with the cosmetic industry, and I'm very outspoken about this even at conferences and royal colleges and things, is most of the anti-aging industry has nothing to do with anti-aging. It's to do with symptom cover up or
Yeah.
kicking the can down the road in some way. There's very few treatments that are actually anti-aging in the sense of aging being a loss of cell function, DNA quality, mitochondrial function, etc.
Mm-hmm.
When you look at what this product is doing, which is called Synacos, and it'll be in the video as well, that actually is anti-aging because it's restoring what we had when we were younger, and the cell function is coming back to like we were younger. When
Mm-hmm.
we look at the testosterone propionate cream, that's activating the androgen receptors like when we were younger. That can have an anti-aging effect. I would also consider something like LED treatment actually anti-aging, because when you use things like certain types of near infrared and red, you're
Mm-hmm.
optimizing the function of all the proteins on the mitochondrial inner membrane specifically. So around the electron transport chain. Once you do that, you actually do improve mitochondrial function, which means you are actually doing anti-aging treatment. So
Yeah.
LED, I would class as that as well.
Mm-hmm.
And I'd say they're probably the top three genuinely and technically speaking anti-aging treatments. Everything else, like volumization with filler, toxin treatments with whatever Botox brand you want, etc., they're specific goals for specific symptom cover-up. I wouldn't class them as anti-aging.
Yeah.
So in terms of anti-aging, I would say they're the top three for me,
Okay.
if we're being pedantic.
Yeah. Well, no, I'm really interested because we use infrared with neuro reset technique, but what we're doing
Yeah,
is working on your bioenergetics and exciting the mitochondria in the cell to work more
yeah,
effectively. And so working with the nervous system and brain, I know that every input has a different response in your body depending on how your nervous system has been wired up. And
100%.
infrared can actually put people into defensive states and actually shut them down at a neurological level. And so when I test that in people, I see that really quite frequently. And you
Yeah,
actually treat it using NRT so that you can take that stimuli. So that receptor is that
yeah,
pathway is strong and it's not actually shutting you down to have that infrared put on
yeah.
you.
So
So I've
what
got
we
quite a
find
process machine.
in, in
Yeah.
terms of the near infrared, I would suggest the brand to use is Dermalux, which is available in New Zealand. Because when we look at the evidence for near infrared, we find that the specific wavelengths with the most evidence seems to be 830 nanometers. So when I get a device that can very, very accurately replicate that, plus or minus only around 2 nanometers, which is extremely tight and the tightest in the world,
Mhm.
I've never actually had a negative outcome. I've never had a flare up of any kind. And what we find is the method of action seems to be the photo displacement of nitric oxide by interacting with the copper B ion within cytochrome C oxidase. And so once we displace that from the binding site, we can then allow oxygen to come in straight away, instantaneously. So if we get more accurate reproduction of the 830 nanometers, we find even if you misuse the device, there's never any negative outcomes.
Right.
So I'd be interested to see what you think if you could try different devices
Yeah.
and see what the difference is.
Yeah. Yeah. Would be interesting to look at.
Yeah.
I got a what are they called? Endolights. You know, have you seen the endolights that you can get that have all
Yeah, yeah,
colors? And so
yeah.
I got one when I was in London last year. I went through a big detox last year and worked with
Okay.
Dr. Downing. I don't know if you come across Dr. Downing in Harley Street. Um, he's
Name rings a bell. So I
yeah,
work on Harley Street.
yeah, he's awesome. He's He's does lots of different things. But yeah, anyway, I'm so excited for this next piece. And thank you so much for just sharing all of that information with
You're
me.
welcome. You're
There was
welcome.
in slightly different alien languages at the end there, but I picked up most of what you were putting down.
I mean, if you want, I can
My job
I'll
though.
send you a link to another video. I did an interview with this Australian cosmetic thing or whatever,
Mm,
where I explained how those kind of devices actually work and how people end up ripping you off because the quality is not very good. I'll
yeah.
just send you that in there.
Thank
And then
you.
also I did, because I invented some protocols for LED therapy, specifically near infrared and red.
Ah,
And it really pisses me off when people make crap devices and sell them as being something phenomenal.
yes.
So if I give you that one as well, that's a podcast I did, where it's just about LED treatment, and it's detailed. It might put you to sleep, both of those two. But if you're really interested, there's some stuff in there for you.
Amazing. I'm just going to copy those too. Thank you so much. Um, Fabulous. And then I guess my only other question is, so there's no negative side effects, there's no contraindications for anyone specifically using this stuff.
Legally, there has to be some contraindications. There's a typical one, so pregnancy,
Right.
because you're not allowed to test on pregnant women. There's also, I think, active infections, just because the needle might pick up bacteria and move them somewhere else.
Right.
Um, Basically, the standard stuff that you get in every medication is the contraindication.
Yeah.
Um, Theoretically, the contraindication is also things like psoriasis and eczema. However, I actually use this stuff to treat psoriasis and eczema, and sometimes it does it within 24 hours. So it's a lot of it is actually just down to the fact that you can't test in these people rather than
Mm,
it actually being a contraindication.
yeah.
So the contraindications are split in two. One is true contraindication, and
Mm,
one is what you have to say as a company because you're not allowed to test on people.
yes. Yeah. Yeah. I know all about
Yeah.
that. That makes perfect sense. And I guess because so I have suffered eczema. I was born covered with it, like really sick from baby, and always suffered from eczema. And even being paleo for almost like 20 odd years and no processed foods or sugars or seed oils or any of that, even with all that, it was a state. When I was
Wow.
carnivore, yeah, it got better. But I still get the odd flare up of it. And yeah, even being this many years in, I still will get the odd bit patches of eczema. So
Whereabouts do you normally get it?
I'll get it mainly on my hands, a little bit
Okay.
patchy. And I figure that's just a lot because of being a mum and having a lot of wet hands and clids and all the things. And then elbow patches sometimes. Sometimes I'll get it in my inner arm. Sometimes I'll get little
Okay.
on my stomach.
Okay.
And sometimes at the top of my thighs as well. It's random.
Okay.
And it started so oh no, it started. I have had it on and off since forever, but obviously it's gotten much, much better than it used to.
Yeah.
But when I 20 years ago had breast implants. And
Okay.
then a few years ago, I started getting kind of red, like eczema spots around my chest. And so
Yeah.
I went to the doctor and da da da. And I believed that it was to do with having this foreign object in my body that was essentially poisoning me. Um,
Yeah.
Even though I didn't have any leaks or ruptures, technically, it's still, absorbing into my tissues. And so it really put a rocket up my butt to get them out of my body. And so last year, 2020, yeah, three, I had them out. And that was after wearing them.
Okay.
That was part of the reason that I was working with Dr. Downing in Harley Street when I was over in London
Ah.
to
Okay.
detox all the crap out of my system and, have
Yeah.
venous lasers beamed in and lipid
Yeah.
transfusion,
Yeah.
all sorts of different things. Um,
Wow.
and so, yeah, since then, it still flares up and down and I get it on my chest as well and around like on my tissues. And yeah, and it flares up, appears to flare up with my nervous system. So as I'm dysregulated or as my nervous system's under like strain, it will flare up with stress.
Okay.
Um,
Yeah.
but it's low level there in those patches, and I'm always managing it with tallow or something, rubbing that into my skin. Um,
Okay.
yeah, I thought for a long time it was oxalate dumping as well, because I ate so many
Yeah.
products for so long. I'm like, this is coming out of my body, and I have had oxalate crystals come out my legs. Um,
Yeah.
so I'm like, I'm not sure if this is all part of the kind of like dumping or
Yeah.
not. Um,
I mean, that's pretty late for dumping, isn't it?
yeah,
And delayed.
but
I mean,
then
if you're my patient in London,
mm,
I would I would inject this stuff into those patches, and I would
mhm,
be very surprised if anything actually came back, at least for the time that it's there. And I
yeah,
would look to put you on the nutraceutical version of it, so you get like a systemic effect every
yeah,
day as well.
yeah.
I mean, this nutraceutical is so strong. Italy were using it to the part of the reason the COVID rates started to dip in Italy
It's because they were
was
using
because
it.
they use this
Yeah,
systemically.
yeah.
And they gave it to people in ICU, and they've actually given it to military armies around the world as well because it speeds up wound healing.
Wow.
So if you were to, I mean, I'll give you the name of the nutraceutical version if you like.
Yeah.
There's no supplier in New Zealand, but there is an Italian. There's a couple of Italian places. If you Google it, they'll ship it to New Zealand. And in the first link I sent, the talk, I do actually reference this and what it can do.
Okay.
So I think if you were going to try this treatment,
Mhm.
I would suggest whoever you go to, get them to inject the product. So the body version is just called Sunnicos Body. It's quite easy to remember. Get them to inject that in, let's say, one side of you where you have these patches, just so you've got a control to observe. And if you
I,
like it, you just
yeah.
and if you do that, what I'll do, if you're interested, I will put you in touch with the right people that tell you where to get it in New Zealand, the suppliers basically,
Yeah.
and they can tell you who they think is going to be the closest to you or whatever. And if there's an issue in terms of are they unsure about injecting it into where you say you've got uh, bits of eczema or whatever,
Yeah.
I'm happy to have a chat with them and then advise them to do it.
All
And then
right.
they've got some, because
Yeah.
if I put that in writing,
Yeah.
they'll then be covered by insurance because I've written that it's okay to do.
Okay. Amazing.
Yeah.
Sounds great. Could you use this on
Yeah.
children?
Yeah, absolutely. I have.
Great. So my,
In fact, let me show you something pretty extraordinary. Basically, I'll just bring this up. You carry on. You carry on.
yeah, no, I was just going to say, so when my youngest is almost 4, and
Yeah.
she had, I think it was like her second or third lot of vaccinations. With
Yeah.
the second vaccination, she just was absolutely covered. It just brought on eczema all over her legs, and then we have basically been trying to heal her since. So she's carnivore baby. She is
Yeah.
literally been meat eater for life. Oh my gosh, is that
Yeah.
burn? Is that burn?
That's systemic burn. Yeah.
Wow.
And
Oh,
that is with the wound healing
oh
version of
wait,
the same technology. Yeah.
that's
And
insane.
that's not even cherry picked. Like that's standard.
Wow.
Um, I mean, look at that.
Whoa.
And then, people say there are things like exosomes and polynucleotides which are good at healing. They're terrible. You can't use them on things like this. But
Oh.
if you use this product, 4 weeks, you can't
Whoa.
tell anything happened
Oh
apart from sunburn.
my God.
This is honestly how powerful it is. Like it will literally rebuild bone because you're not just talking skin now, bone, fat, muscle, connective tissue, skin, everything.
That's amazing. I'm
And
so
this,
excited.
and that was, I think, due for amputation. But the guy's got his leg again. Like people don't realize how powerful this stuff is. The reason they don't know it is because the company that makes it it's not a, they don't sell it and they don't market it. They just research and develop, just a team of scientists. That's it.
Wow.
So what happens is their business model is they work with distributors in countries of existing networks to sell. They give them an exclusivity contract for that country, and then that distributor has to market it in that country.
Oh, right.
So
I
it's
get
down to the quality of the distributor as to whether
yeah.
people in that country have heard of it or not.
Yeah.
And so it's very difficult. I mean, the reason I became a customer was because I just, like carnivore, I stumbled in by research. I
Mm,
stumbled across this just by research.
Yeah.
And then I started shouting about it everywhere. The manufacturer noticed and said, "Look, are you happy for us to use your videos and maybe work together now and again?" And I said, "Yeah, sure." And that's how I came to tell people about it now.
Amazing. So amazing. I love finding these things. And I am very much like that too. When you find something that is life changing, it's just so
Yeah,
exciting. I get so like, because a lot of people that I work with are in a state that they've tried everything else and they're pretty hopeless and they're, and they just really want to get better. And
yeah.
I love finding stuff like this because that's
I
exactly.
mean, here's something that will wow you even more. So we talk about true anti-aging, right?
Mm.
And Botox isn't that, filler isn't that. And the reason I'm pedantic when people ask me that is because aging we can define as getting closer to cell senescence as one way of thinking about it. And when we think about, okay, where do we use senescence? Where do we want senescence? Well, it's chemotherapy because we're trying to age cells on purpose so they die. We just
Mhm.
want everything to die. And that's what we use doxorubicin for. This product is now so powerful that if you were to inject a tissue with this product and then you subject it to doxorubicin, and this was done in a cell model, the tissue becomes so powerful it resists the actual chemotherapeutic agent doxorubicin.
Oh my
And
God.
that's the publicly available patent for it. And this is all the data. So all
Oh,
these different bars are treated versus untreated, etc., to show you how it's working. And there's a rough mechanism of how it's altering the mitochondria. And this is all the publicly available data anyone can use to say, oh, it's not true or it's true. But it is 100% true because the patent's public. So it's
cool.
extremely powerful. Extremely
Amazing.
powerful.
Exciting. Oh my gosh. So
Yeah.
I'm using it. Happy's going to be using it. We're going to be putting it's going to be all over everybody. No, I'm super excited because I really regretted immunizing my kids like badly.
Right. Yeah.
And they all had reactions to immunization,
Ah.
three of them. And yeah, it's funny because I worked in a medical center for like, I don't know, about 7 or 8 years when I was going through university. And it was just
Yeah.
standard that I saw that that's what people did when they had children. They vaccinated their children. And,
Yeah.
you're very much, it's the norm. And all the nurses around are saying that, if anyone doesn't get vaccinations, it was like, oh my God, that mother doesn't vaccinate her children. It was, just in a subconscious way, it was always kind of in my surroundings. And I always thought it was normal. And then when I did it, I was actually like, shit, I should not have done that. But it's really
Yeah.
all of them. So I'm excited to see because carnivore has helped her so much heal a lot of
Yeah.
her issues, but she still gets massive flare ups in her skin. And
Right.
it will be all over her legs. She's and like really sensitive to soaps and stuff. The girls went and put water on the trampoline the other day and asked if they could put some dishwashing liquid onto the to slip and slide around on the trampoline. And her rash was like she was absolutely covered in it. Like I should not have let her play in the detergent. But yeah, I'm so excited to see how this is going to help and heal her. And it'll be really easy to put it on just pieces of her body and then see
Yeah.
have a very clear control. So yeah.
Yeah, yeah, definitely. I mean, there are skin like cream versions. But what I would say is you're going to get that massive, significant push forward with the injectable because you're not relying on penetration then, and you've got everything straight away. As to how old is your daughter with the
It's
issue?
almost four.
The only issue you're going to have is whether or not someone is willing to treat her based on their insurance, because
Yeah.
typically the insurance is for 18 and over.
Mhm.
Um, that's the only difficulty you'll have,
Okay.
but you can give it a try, see if
Yeah.
anyone will do it.
Yeah.
Yeah. Worst case scenario, you could try LED as well.
Hmm.
If your family's coming over, they could, in one of the links I sent you, which is like a link to where I did an interview about one specific LED mask, which I think is probably the best in the market now. They could maybe pick one of those up here
Yeah.
and bring it with them to you.
Yeah.
And the great thing about that, it's only £99. Like
Oh,
it's super
wow.
cheap. And yeah, and I think I believe it is the most powerful LED mask in the world now. And you can
Okay.
measure the energy from that.
Amazing. I'll get one of those as well.
Yeah.
Throw everything I can at this because,
Yeah.
She's only 4. She should not be dealing with this kind of thing.
No, no.
Especially being a carnivore
Yeah.
baby. So everyone's like, oh, you know, she's expecting her to be super, super healthy. And she's got
Yeah.
like
Any
really,
excuse.
yeah.
I think
Maybe,
she'll be okay.
yeah. Yes. She's in the right hands for sure. We're doing all the things.
Yeah.
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 Thank you so much for meeting
Yeah.
with me and like just
You're
sharing
very welcome.
information with all of my audience. I know they'll get a ton of value out of the things that we've talked about today, and we'll be excited to follow along and see the changes that it has on me and the rest of the family as well, making some of these different changes and trying some of these different protocols. So I really
Oh, is it
appreciate.
recording? I didn't even realize we're recording.
Yeah, it did record.
It's fun.
We can also do another one.
Nice, man.
It records automatically when it and sometimes when I don't record things, I'm like, oh, there was so much gold in that conversation. I really
Yeah.
should have recorded it. So
Yeah.
it may or may not end up on my YouTube. But
This is how new I am to YouTube. You see, I've no idea what I'm doing.
me either. I haven't used YouTube yet, but I keep meaning to. And I have all these amazing conversations and I meet all these amazing people. And just
Yeah.
being in my industry, because there are only 25 of us globally that do.
Wow.
I do, yeah. And so it was interesting before when you were talking about like how to describe yourself in a way that gives someone an idea of what you do or how you work. It's the same situation with me as
Yeah.
well.
Yeah.
I'm just so blessed to have these different connections and stuff. Like obviously working with Bart's been really interesting because he was my professor at university. And then I have now treated him as a patient and client.
Oh, wow.
It's like this whole weird 360 twist.
Yeah.
Because I work with a completely different system that he does. And he's a very science-minded human, as you know, and he was
Yeah.
skeptical. And obviously being a physiologist, he was like, how does this work? And we actually started by just doing some online sessions. So that was really cool. That was one good thing of lockdown 2020 is we actually got to learn how to do this virtually. And
Yeah.
he had a very old, like 31-year-old motorcycle injury where had damaged his shoulder and all of the tissue
Wow.
atrophied and it was really weak and painful. And he had zero range of motion. He had to sleep with pillows all tucked around every angle of it. And
Wow.
like 4 or 5 sessions online and he had full mobility, full strength, full control, full function of his arm.
Wow.
Yeah. And he was
Wow.
like, what on earth is this magic? And so, yeah, since I've been back in New Zealand, he flies up. We'll spend a week up here. I'll treat a whole heap of stuff. We've done a little bit of testing and recording as well, too, because when you do the treatment, it is instant. And you
Yeah.
know that in order to get stronger, it's gradual adaptation and overload. And what we're saying
Yeah.
is make you stronger instantly, and you get to keep those results. So we used a dynamometer and did some testing on his hamstring. He'd torn his Achilles tendon last year playing cricket. And we tested it and his force output was like petty. And then we treated it all, restored all the receptors, the joint receptors, the muscle receptors, all the pieces of the pie that were showing up weak. And then he doubled his strength output in 10 minutes. And it's just
Wow.
like mind blowing when you see the results of this treatment, how it works. It's so cool.
Wow.
So
So are
yeah,
you based North Island or South?
I'm North Island. Yeah. So
North. Okay.
yeah.
Fine.
So
Nice.
when you're coming these ways again, come and have a
I was going
session.
to say, I'll let you know.
Oh my gosh, come and have a
Yeah,
treatment.
that'd be amazing.
How it works. It is quite a head screw. I was in health, as I mentioned, for so long, and I had tried everything on myself, and I'd done all these different postgrad things, and I thought I was very good at what I did. And then when I saw this, it's like you realize how deep the ocean is. It was just like
Yeah.
holy, everything that I thought I understood about human function is not right. And yeah, it's just amazing. So I get to work with all sorts of different chronically ill and injured and sports people and all sorts of different types of humans. Um,
Amazing.
and so yeah, I'm excited to be able to connect with other people to help different parts of the areas of health that I can't do. Because my job is very unlimited in the things that we can help people with. So I'm always excited
Yeah,
to find something else. So thank you so
definitely.
much,
Well, I'll
Alex.
let you know if if I'm going to be there, it'll be probably partway through next year, I think, maybe sort of halfway through.
Oh,
What I would like to do as well is maybe fly down to see Bart and do a podcast,
yes.
but maybe the first ever in-person podcast with Bart Kay because he refuses to leave New Zealand. So I might have to fly see him and then we can tie something in.
Oh my God, totally. He's just bought a new house. He's bought a
I've
whole
seen, yeah.
property, his little Barshia or whatever he's calling it. But yeah, we're going to go down for a week soon and collab some treatment with some bits because he was going to fly up and do some treatment before he went to Australia, but it's just gotten too tight.
Oh,
But
okay.
in the meanwhile, is we could always do an online session. It is
Yeah,
so much more impactful in person because you can
I
see and
know.
feel the changes. However, it still works virtually and it is bloody effective. So as I said, we restored every muscle and joint motion function to his arm in 4 or 5 hours. So I could do that
Wow.
in an hour if you're here, but you know, it still works. It's still effective online. I've worked with and been able to help hundreds of people online virtually with
Wow.
tools. So yeah, we can always do something virtually as well. I can show you how it works. It's pretty cool.
Amazing.
Yeah,
Amazing.
cool. Awesome.
Yeah. Give me a shout if you need anything.
Yeah.
And I'll put you in touch with whoever you need if you wanna go ahead and get some stuff done.
Yes, I'm going to do all of it. So just send me all the things and I will order the LED and I'll order the testosterone, whatever you
Yeah,
call
I
it,
can sort that out for you.
and all the things. Yeah, if you would help me with that, I would so appreciate that. It would be amazing.
No problem at all.
Thank you, darling.
All
Awesome.
right.
Nice to meet you.
You too. You too. I'm sure we'll meet again.
Yeah, have a good evening. Sleep well.
You too. Take
Cool.
care.
Ciao.